The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Today on Aging Horizons, we're going to be talking with Janet Stellman. She's the SHIP director at the DPHHS, and she's going to be telling us all about Medicare. We're going to go over what it is and what are the programs that could help you pay for some of your Medicare costs. There's lots of really important information that you're really not going to want to miss today on Aging Horizons, so make sure you stay tuned.
Montana veterans, your independence matters. The freedom to age with dignity, how and where you want for as long as possible. Please help us improve long-term veteran care in Montana by taking a short online survey. Go to veteransurvey.mt.gov. Your long-term independence is our priority. Go to veteransurvey.mt.gov and help us get it right, Montana. This message brought to you by DPHHS, the Montana Veteran Affairs Division, and this station.
You've probably seen some big-name celebrities on your TV lately talking about all the Medicare benefits you're missing out on. But the insurance companies who are paying for these ads may be pushing benefits not available in Montana. Fortunately, help is available from a friendly state health insurance assistance program counselor who can help you sort it all out. It's free, and we screen everyone for eligibility regardless of your zip code. It's Montanans helping Montanans. Call today.
Respite. It's okay to need it. It's okay to want it. Will you provide it?
The hard part about having outside help is that there's not a lot of people out there who can do that kind of work. We've been very fortunate that our Bonnie has been with us for 7 years. I don't know what I'd do without her. I need her in our lives. She's our second mother. And I can't help but think of her that way.
To find out how to change lives, including your own, call 800-224-6034 or visit respite.mt.gov.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
Welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Katie Lovell, and today we're going to be speaking with Janet Stellman. She's the SHIP director for the DPHHS of Montana. Janet, thank you so much for being with us today.
Thanks for having me today.
Yeah, absolutely.
I'm glad to be here.
Let's talk, I said your title, the SHIP director, but what does that actually mean?
SHIP stands for State Health Insurance Assistance Program, and we are a program that's nationwide. Every state has our own SHIP program, and we're just there to help Medicare beneficiaries through the maze of Medicare.
That's so important that there's someone there to help them too.
And we have SHIP coordinators or SHIP counselors in every county. They may not live in the county, but they cover the county, and so they're only a phone call away.
That's wonderful. So let's talk a little bit about Medicare. What is Medicare? What does that even mean?
Right. So Medicare is a federal health insurance program for people that are age 65 and older, and people that have disabilities, that have been on Social Security disability for 24 months. It's a program just to help with medical costs. So
sure.
Traditional Medicare is Part A, Part B, and maybe a drug benefit. Part A is your hospital coverage. So every time you go to the hospital or inpatient type stuff like that. Part B is your medical insurance, so your doctors, your durable medical equipment, your outpatient type stuff. Part D, prescription drug part of Medicare, is to pay for help pay for prescription drugs. So Medicare started way back in 1965, but it didn't have drug coverage until 2006.
Wow, that's a huge difference.
Right. So, and they're not all perfect programs, but they're, especially that drug plan is, the Part D is getting better over the years, especially with the closing of the donut hole that used to be there. So that is a traditional model. Medicare is an 80-20 split, so Medicare pays 80% and the beneficiary pays 20% after deductibles.
Okay.
With Part A, most people get premium-free Part A because we've worked 40 work quarters or 10 years. So we'll have free or premium-free Part A. Those folks that don't have 40 work quarters or 10 years will have to pay for their Part A if they need it. So that's up to like $500 a month.
Wow, that's a
so
huge
it's pretty spendy.
And Part A is the same for everyone, is that true?
Yes. Okay. Part B this year is $174.50, I think, per month, and that can come right directly out of somebody's Social Security check, or they can pay for it monthly. Part D is there's different plans to choose from, so they're anywhere from I think there's like a $7 plan all the way up to a $200 plan.
Sure.
And so not every plan covers every drug.
Oh,
so
sure.
they have to cover their formulary is what the drugs are that they cover. They have to cover every class of drugs, but not every drug in every class.
Sure.
So it's a SHIP counselor can help wade through that and help you to find a plan that best covers your drugs and is hopefully in your price range. So
a person can choose a different Part D plan from their neighbor, from their spouse.
It's more personalized on what's going to work for them. Absolutely. And what worked for them one year may not be the best for them next year. The second way to get your Medicare, so that's traditional Medicare. There's also the Medicare Advantage plans or health plans. And those are Medicare gives private companies like Humana, United Healthcare, Blue Cross Blue Shield gives them a pot of money and says, okay, you've indicated that you can provide services cheaper than what traditional Medicare can, so we're going to give you a pot of money and you administer their Part A, their Part B, and possibly their Part D. And Medicare Advantage plans or health plans are also sometimes known as Part C. People are like, what's Part C? Well, that's what. So they are through private companies, and usually they have premiums anywhere from $0 to $200, around $200. It has to cover everything traditional Medicare covers, but it usually covers it differently or in a different way. So like instead of when you go to the doctor on traditional Medicare, you're paying 20%. With a Medicare Advantage plan, you might pay $5 every time you go to the doctor, your primary physician. Another thing about Medicare Advantage plans, usually they're network, so you're needing to get the best price, you're going to have to probably find a doctor, a preferred provider, or a main doctor that's in network. So,
and that can be probably harder in some parts of Montana.
It can, especially in the smaller areas.
Sure.
So that can be. Some of the nice things about Medicare Advantage plans is they sometimes cover extra than what regular Medicare covers. So dental, vision, and hearing, there's a little bit of benefit in most of the plans. It's not a lot usually, but it's a little. Yeah. It's a cleaning or two a year, depending on the plan, of course. So, and then they also have a maximum out of pocket. So with traditional Medicare, you're paying your 20% all year long. With a Medicare Advantage plan, they have maximum out of pocket. So they're anywhere from, I think the lowest one's $4,200 to all the way up to like $12,000 or something.
Sure.
So what that means is, let's say you go into the hospital and have a surgery and your portion of the bill is $10,000 and you're in a plan that has a $4,500 maximum out of pocket. You're only going to be responsible for $4,500 of that $10,000 surgery.
That's so important.
And then Medicare will pay then the company will pay the rest for the rest of the year. So
wow, that's a big difference.
Yeah.
So someone would either have traditional Medicare or they would have an Advantage plan, but they likely wouldn't have both.
No, you can't have both. There are some Medicare Advantage plans that let you that don't include prescription coverage, but you can pick up a standalone prescription coverage plan. Sometimes that works good for certain people, but most of the time it's best to get your prescription plan in with your Medicare Advantage plan. So
wonderful. Okay, when we get back, I want to talk a little bit about how someone enrolls in Medicare. Okay. So make sure you stay tuned, because we're going to talk about how you enroll in Medicare, and then what happens if you have a situation where you need a special enrollment period. So stay tuned.
Perhaps Perhaps our regular viewers have noticed that we've been missing a host for the last several months. In July, our favorite person, Kimmy Everman, unexpectedly passed away, and we'd like to take a few moments now to share some memories that we have of her.
For many of us, watching Aging Horizons with Kimmy as the host was like talking to a friend, and for Kimmy, that's exactly what it was. She cared about all of the viewers of Montana on Aging Horizons as if they were her personal friends. She wanted each of us to live the best possible life and connect to as many services as possible. She had no greater joy in life than connecting advocates to others that could help Montanans across the state with problems that they maybe didn't know as much about. Losing Kimmy was a great loss to the state of Montana, but the work that she did will live on in the hearts and minds and Rolodexes of so many of us at the state.
So working with Kimmy was always a very fun experience for me. She lit up a room with her smile, and I loved her giggle. She had this giggle that was the cutest, most happiest spreading of joy that I could describe. She also was very passionate about her work, about helping veterans, and about her dog Sophie.
Kimmy's been my friend, my coworker, and my mentor for over 20 years. She has taught me so much about not only Medicare, but working with people. She had a great sense of compassion and love, especially for veterans, animals, and the underdog. She loved working with seniors and people with disabilities. That was her heart. She will be greatly missed.
Aging Horizons has been on the air for over 30 years, and I've had the pleasure of working with these wonderful ladies and everybody in senior long-term care that length of time, including Kimmy Everman. And whenever we got done with the show, I just loved her laughter, which everybody's commented here. It was like we're getting away with something. Isn't this fun? And I will sincerely miss both that and her.
Welcome back to Aging Horizons. Today we're speaking with Janet Stellman. She's the SHIP director for the state, and we're talking all about Medicare. So we covered what Medicare is. Now let's talk a little bit about how you get on Medicare. How does the average person get on Medicare?
Right. So making sure you get into Medicare when you're first eligible for is really important. When somebody turns 65 and they're retired, maybe they're not going to work or anymore, don't have any other insurance, it's very important that they sign up during initial enrollment. Initial enrollment is 3 months before, the month of, and 3 months after the 65th birthday.
Okay.
So if you sign up in any of the months before your 65th birthday, it'll start the month of your 65th birthday. If you sign up the month of your 65th birthday, it'll start the month after.
Okay.
And so on. So if you don't have other coverage that's as good as or better than Medicare, mainly it's through your employer if you're working still. Sure. Those are times that you may not have to take your Part B or a drug plan. It's just going to depend on your current coverage. But if you don't have any current coverage, it's really important to get into Medicare when you're first eligible for. If you don't, you'll have to wait till general enrollment. General enrollment is only once a year, and it's from January 1st through March 31st every year. So you might have to go, 7 months or something without medical insurance. So the other time to get Medicare is maybe you've been on Social Security disability for 24 months. You're going to be eligible for Medicare. So it's time to be able to sign up for Medicare coverage. So that's really important to do too. And so that's called the initial enrollment. Then I spoke briefly about the general enrollment, which is every year from January 1st through March 31st. So if you didn't sign up for Medicare when you first should have, or you were first eligible for it, you can sign up during that time. So if you sign up in January, it'll start in February.
Okay.
If you didn't sign up for Medicare when you were first eligible for and had to wait till the general enrollment and you didn't have any other coverage, Medicare has penalties. So for Medicare B, if you didn't sign up when you were first eligible, it's a 10% per month that you didn't sign up.
Wow.
Yeah, and so that can add up quite a bit.
Yeah.
10% of $174.50 is $17 right there. And then same with prescription drug plan. If you didn't sign up when you were first eligible for, then there's a 1% per month penalty on that one that you didn't, for each month you weren't in when you should have been. And that's similar to, you don't buy car insurance after you get in a car wreck.
Absolutely. Yeah.
It's just the game of insurance. And so there are low costs, especially for the prescription drug plans. There's low cost options. Like I said, I think there's a $7 plan or something that you could get into, if you didn't take any prescriptions, but at least still, you might not take prescriptions now, but later on you're gonna. So
sure, an antibiotic, something like that. Yeah, absolutely.
Right. The other time to sign up is special enrollment periods. So if you retire,
sure,
that's a special.
You have been working, but now you're not.
Yep, and you're losing your insurance, your coverage through your employer. That's a reason for you to be able to sign up mid-year. A lot of times with prescription drug plans, there's a lot more special enrollment plans to get into a drug plan. So traditionally, if people are in a plan, a prescription drug plan, they're in that plan for the year.
Sure.
So the plans can change their formulary every 2 weeks. Prices can change, but that person might be stuck in that prescription drug plan for the whole year. But there's special enrollment periods, so all of the SHIP counselors are familiar with those special enrollment periods and will look for a special reason to get you into a different prescription drug plan or a different Medicare Advantage plan if that's what you're wanting. So it could be you've moved, you're eligible for Medicaid, you're eligible for extra help, you leave you retire. There's like a whole little document that we have that we keep by our desks to see if there's a reason to get you into a different plan mid-year if you're not happy with your plan.
So if people are really struggling, they should always reach out to a SHIP counselor.
Yep, and they're just a phone call away. That number that we have on the screen should direct you to your local SHIP counselor in your area. So
wonderful. And then, so you go through the year with your plan. Is there a time every year that you can elect?
And that takes us to annual open enrollment.
Okay.
And so that's a big time of the year for most of us and most people on Medicare because it's time to make some decisions. So every year from October 15th through December 7th is called open enrollment. And that is when you look at your Part D plan or your Medicare Advantage plan and see if it's going to work for you the next year.
Sure.
Because what worked for you one year may not be the best plan for you next year. Like I said, they can change their premiums, they can change their formulary, they can, So even if you love your plan, it's always important to change or, to look at it at least. And SHIP counselors can help you out. It's good to get into them, call them early before October 15th to get on their books because it's very, very busy.
I bet they get very busy.
So that you look at that, and if you're going to change, it's going to be your coverage starting January 1st. So, yeah.
That's so important for folks that are going to have a new surgery or a new drug. So important.
Right. And then we have the Medicare Advantage open enrollment, which at the time of this taping we're in, but by the time this airs it'll be over, but it's January 1st through March 31st too. So it's if you're in a Medicare Advantage plan and you didn't change during open enrollment, but now you want to change to a different Medicare Advantage plan, it's a time where you can change from one Medicare Advantage plan to another Medicare Advantage plan, or you can change from a Medicare Advantage plan and go back to traditional Medicare and pick up a prescription drug plan.
Okay.
What you can't do during this period is you can't go from original Medicare into a Medicare Advantage plan.
Okay.
So
that makes sense.
Yeah.
Okay, when we get back, I want to cover all of those special helping programs because those are so important. So make sure you stay tuned because you're not going to want to miss that information on those helping programs.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
Can you say ombudsman?
Ombudsman. Benson?
Uma Doodlesman? Fortunately, you don't have to say it right to get the help of a long-term care ombudsman. If you or a loved one reside in assisted living or long-term care, an ombudsman can help resolve any issue. And these services are completely free and confidential. Now, why don't you try that again?
Ombudsman.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
Welcome back to Aging Horizons. Today we're speaking with Janet Stellman. She's the SHIP Director for the Department of Public Health and Human Services, and we're talking all about Medicare. Janet, let's talk about, there are some, Medicare is a great benefit for folks. Yeah, absolutely. But there are costs to it. So what happens to folks that cost is a real barrier?
Right. So this is my favorite thing to talk about. I love talking about helping programs because they are such a great help to people. The first one I want to talk about is the Low Income Subsidy or Extra Help Program. That's for people with lower incomes and resources, and it helps with the prescription drug plan.
Okay.
So those people that qualify for extra help or low income subsidy, they will have lower premium costs or no premium costs depending on the plan. They won't have a deductible, and their co-payments will be anywhere from $1 to $12 per drug. And so it's really beneficial. They say the average savings for an individual on low income subsidy or extra help is about $5,000 a year, but we know as SHIP counselors we've seen that being a whole lot more. So let's say somebody's on a really expensive drug and it is on the formulary of their plan, and because they qualified for extra help, instead of having to pay $2,000 a month for that plan or that drug, they'll get it for $3.
Oh my gosh.
So we know, I mean, right there, that's a huge, that's over $5,000. Yeah, it is. And it does make it, it's a difference between being able to take your drugs and not being able to take your medicine. So that is a great program, and see a SHIP counselor. They can help you fill out that application, or you can go to socialsecurity.gov and it's a quick 2-page application.
Wonderful.
So one of the questions on that application, or there's a checkbox, and it says, if you don't want your information sent to the state Medicaid office, check this box. So by leaving that box unchecked, they're going to send your Medicaid or your information, your financial information from that application to the Medicaid office, and the Medicaid office is going to look at a program called the Medicare Savings Program.
Okay.
So, and that's just one way to get into the Medicare Savings Program. SHIP counselors can help you apply for that too, or you can go online at apply.mt.gov. But what that'll do, what the Medicare Savings Programs are, is you've probably heard of them. They're QIMBY, SLIMBY, and QI. There's three different categories there. The Cadillac model I call is QIMBY, or Qualified Medicare Beneficiary. It's for the lowest income and resource type people. So we're talking about $1,000 a month income.
Sure.
And what it does is it pays that $179 or $174.50, whatever the Medicare B premium is every month.
Sure.
If they were one of those people that didn't have enough work quarters and have to pay for their Part A, QIMBY will also pay for that Part A premium. Remember, we said that was like $500 a month. And so that's a big help. And it also acts as a supplement to Medicare. So that, remember I said Medicare pays $80 and the beneficiary is left with that 20%. Well, if you qualify for QMB, it pays that 20%.
Wow.
So it's like having Medicaid or a supplement to Medicare, because it's going to pay your costs there. So that's an awesome program. The next program is the SLIMBY or SLMB program, and it has a little bit higher income guidelines, and it just pays for the Medicare B premium, so that $174.50 or whatever. Sorry, I should have checked the exact amount because I can't remember. And then the third program is QI, or Qualified Individual, and that's for people with a little bit higher income. And one of the differences, and it just pays the Medicare B premium, so that $175.50 or whatever it is. And the difference between SLMB and QI is that there's a little bit higher income limit, but you can't be on any other Medicaid program. So if you're relying on Medicaid every month and you know that you're going to have lots of Medicaid expenses or medical expenses, you may want to opt out of QI and go with Medicaid instead. But maybe you don't have a lot of medical expenses and QI makes more sense to just have your Part B premium paid.
Sure.
Then you have to decide. They can overlap 1 month, so that's fine. But so those are the 3 programs, and they say the average savings there is about $2,000 a year. But looking at Quimby, especially if it's paying that 20%, it's a lot more than $2,000 a year. Yeah. Some advantages of having any of these helping programs, these 2 helping programs, is it gives them special enrollment periods for changing their prescription drug plan or their Medicare Advantage plan mid-year.
That's amazing.
Also, it waives any penalties that they may have had because maybe they didn't enroll into Medicare when they should have.
Sure.
So that's a big help too. And so yeah, those are great programs. The other program that I like to talk about is Big Sky RX. It's a state-grown program through when Medicare started with the prescription drug plans in 2003, 2006. They created a state pharmaceutical assistance program, and that's Big Sky RX. It was created during the Schweitzer administration. It's for those people that just make a little bit more income and don't usually qualify for things. So the income level's quite a bit higher.
Sure.
And they don't look at resources, so they don't look at the assets or the things that people own. So what it does is it just pays that Medicare Part D premium up to like $38 a month. So
sure.
It's just a little bit extra help, and it's a hand up, not a handout.
Yeah,
so
absolutely.
Don't feel bad. All the SHIP counselors are trained, hopefully, that when somebody comes in their office or on the phone with them, they're getting screened for those programs because they're so important.
Yeah, absolutely.
And don't feel bad about applying. I mean,
sure.
Prescription drugs are expensive. Medicare is expensive. Medical is expensive.
Yeah.
And so if you qualify, that's what these programs are there for. So
absolutely.
And so.
And the way that people get in touch with their SHIP counselor, tell us again.
You just call that number on the screen right there, and it'll shoot you to your local SHIP counselor. So unless you're calling from an out-of-state cell, it'll bring you to me. But I'll talk to you for a minute, and then I'll, if you need more personal help, I'll send you to your local person.
Wonderful.
So.
Well, thank you so much for being with us today. That was such important information. And again, anytime that you need help with your Medicare, call a SHIP counselor because they really are just absolutely wonderful and so ready to help. So thank you for staying tuned to Aging Horizons.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.